bring a pillow.
This is amazing, man. Like, oh wow, this feels comfortable.
Yeah. And you're gonna see it's gonna be a laser scanner right to the feet. This is what it looks like. Your feet should look like this. It should be red, green, and red. Man, it's gonna pop like 4th of July in here. Oh! 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 One.
Oh! Oh my God!
And we got one more.
Oh!
Good.
That was amazing, man.
There we go. He gives us some of his own medicine. He gotta give us all the cracks he gives everybody else.
All right, so I'm actually gonna do a lift.
Oh!
There it is.
Wow. Jesus, is that you? That was great, honest to God. You got more cracks than I got bones. I feel like you're playing with me, dog.
Out.
Oh!
I'm here today with Dr. Rizzo. And you're big on social media, right?
Well, you know, I try to be Instagram and stuff like that. So I try to be kind of educational, informative, and fun at the same time. So that's how I do it.
And where are you located?
We have a couple of locations. One, our main hub is in Alexandria, Virginia, in Alexander City. And then we have a second location on DuPont Circle in DC area. Okay. And so that's our new location.
The new location in DC, gotcha. Yeah. And this is Metropolitan
Headache and Spine Center.
And Spine Center? Okay.
Yep.
So you started your YouTube channel as well, right?
Yeah, so just recently. It's not that it's not that old yet, but we just started posting a lot of stuff, like a longer version of what we have on Instagram, on YouTube.
I see. Okay. But you don't have a name for it yet. But if they type in Metropolitan Headache and Spine Center, it should.
Exactly, yeah. So we're trying to get a bigger presence on YouTube right now, but if you type in Metropolitan Headache and Spine Center on YouTube, it should pop up for our videos. Yeah.
Okay. And I also add a link to the description.
Yeah. Oh,
that way they can just click and then go straight to your
Excellent. And it's also in my bio of my Instagram. So if you click on my bio, and you'll see the tag.
So what's your Instagram address?
My favorite doctor. So you know, I also know he's also your favorite doctor. But my favorite doctor. So it's 3 words: my space favorite space doctor. Okay. And that's the.
Is it underscore or is it a space?
So it's my underscore favorite underscore doctor. But if you just type in my space favorite, it usually just pops up.
It'll pop up.
Yeah, it'll pop up. Yeah.
Gotcha.
Yeah,
all right. So we'll add a link to the video as well.
Yep.
That way they can just check you out.
Yeah. That'd be cool.
So show us around. I know you have some ergonomics type of settings and things like that.
So we try to be sort of very holistic. One of the main things that I've noticed, and I'm sure you have too, where people sit in front of desks and chairs all day and it doesn't fit them, so they're going to tension, they cause a pain, come back again. Gotcha. So what we notice is that not just we fix them here, but we fix them at home. So we have, we partner up with Ergo RX here.
All right, so Simon, right?
Yeah.
Shimon is
Shimon.
Polish?
Yeah, it's Polish.
Polish, exactly. Okay. So you're the person responsible for this setup, right?
My wife is.
Your wife is, okay, but it's you guys, your company, right?
Yes.
Okay.
So she's a physical therapist, so that's her knowledge and her experience within the physical therapy and the ergonomics, industrial and both office and corporate ergonomics area kind of merged into creation of the products we have here. So that was kind of like the supplementation of the the need in the market.
I see. Give me some information. So like the setup, like I know this chair feels pretty comfortable. Wow, yeah. So it basically causes you to sit upright. It works well for the lumbar.
So yes. So what
I need to get one of those actually.
What we usually do is we base our posture based on automotive ergonomics.
Typically, my patients will go into this position. Well, of course, because of gravity, right?
Yes.
But then that's how they feel comfortable. But imagine when you're in a forward head posture, the amount of tension it places on the cervical spine, the shoulder, the thoracic. But sitting on this chair right now, it automatically causes me to go back. And I feel great,
Perfect. So this is an excellent chair.
It's wonderful.
It's a very good ergonomic task chair with the adjustable lumbar. As you see, this is actually a smaller size. So the reason why I like this is it comes in 3 sizes. so I can fit the workstation to the user.
Gotcha.
Doesn't matter if they're 4'7" or 6'8".
I see.
I'm still going to be able to, place them, in the right posture.
I see.
This is the way we were able to address the bad ergonomic posture.
Okay.
We don't have support. Usually people go and
Okay.
sit down in the chair in the 90 posture, and they're trying
That's
to
right.
reach this thing that's very hard to achieve.
Right.
But what ends up happening is the keyboard and the mouse are
Yeah.
placed on the desk. So
Right,
the
I
first thing you're gonna do is you're gonna lean forward
Right.
and start slouching because you need to reach your equipment.
Equipment. Right. Okay. I see.
So this is our product.
Wow.
The keyboard tray and the combination of the length adjustable footrest.
Wow.
Because everybody's different.
Right,
Some people
yeah.
are taller, shorter. My 5-year-old is using it.
This is
Yeah.
awesome.
So this way, you're able to stay active in the
You can sleep
sedentary
right here,
job.
Doc.
Yeah. I
How about I
know.
just bring a pillow?
This is amazing, man. Like,
Yeah.
oh wow, this feels comfortable.
Yeah.
And especially a guy like me, I'm up 2, 3 in the morning. I sleep maybe 3 hours a day, and I'm always up. Like, this is perfect.
Yeah,
you
yeah,
know?
exactly.
Because I get a lot of back pain myself, because I'm always
Right.
up in my
Yeah.
bed, you know.
Exactly.
And then what's cool about it is he said, "Come on up, come on
Mhm.
up," and you can just. This one is
Alright.
it. Okay, now.
Oh
it's-
yeah, oh,
So
that's,
you-
that's
so
amazing.
Yeah.
You don't necessarily have to go into too deep of a recline, because the more recline you are, the less
Right.
productive you're going
That's
to
true.
be.
Then you get sleepy,
The more you
too
sleep,
comfortable,
okay.
right? Yeah.
Exactly. Then you,
So now, Dr. Rizzo,
Yes.
what is this?
So Doug, if you can't have a horse at your job,
Right.
the next best thing is a saddle. So this is what I got for you.
That is amazing.
So that's
man.
the
That
next
is
thing.
great.
Yeah, that's
Wow.
yeah, nice and good,
That
comfortable.
does, yeah, it feels
And
pretty
then-
good.
Yeah, and
Feels
then
pretty
somebody
good.
comes behind your neck, goes.
Right. So give me the information. I know Dr. Rizzo gave me the
Yeah.
information before.
Yes.
What do you have? You guys have Instagram, website?
Instagram is at ErgoRx. ERGORX.
At ErgoRx.
Yes.
And website?
The same, ergorx.com. Same on Twitter. Same on Facebook.
That's perfect.
ErgoRx.
Or throughout several platforms, same
Yes.
name. Okay, cool.
Ergonomic.
All right, so DMV folks, if you guys are interested, this is the gentleman. You want to check out.
Simon.
Check out ErgoRx.
Yeah.
Simon, Twitter, Instagram. You don't have
Facebook.
Facebook, and this
TikTok.
Is TikTok.
Clubhouse.
TikTok.
Where is he not there?
LinkedIn.
LinkedIn. Okay,
LinkedIn.
perfect. So check him out, and if you have any questions, just reach out to him.
All right, I got a couple things. It's similar to what he does, but it's the style is a little different. Okay. The first thing we'll do is we'll just do a full head, upper back, and neck adjustment for him. Let's see, here's some tightness and stuff. Oh man, it's gonna pop like 4th of July in here. When's the last time you've been adjusted, Doc? It's been a minute, huh?
It's been a minute, yeah.
See?
It's been
All right,
a
here
minute.
we go. Let's get it. Let's see.
Oh,
There it is. Hello. Good morning.
Woo!
Wow.
Yes, sir.
Yes. There we go. This one's even worse. More.
Oh!
He did.
Woo!
Come back to life. You
Yes,
saw heaven, the
sir.
pearls,
Oh,
the gate. All right.
that
There
was
we go.
amazing, man.
There we go. Let's go on your
Wow.
stomach facing down.
Oh,
That was just appetizer, Doc.
oh, man.
You ready for the meal?
Yes,
All right.
sir.
Here we go. 4-course meal here.
Mm.
All right. Take a deep breath. Breathe out.
Oh,
my God.
Oh, yes, sir.
Give him some of his own medicine. Give him some, for all the cracks he gives everybody else. He deserves this one. I'm beautiful,
Oh,
are y'all?
man.
All right, here we go. Let me show you a couple of cool things here.
Oh,
Let's face me on your side. Let's stick on your shoulder.
gotcha.
Yes. So everyone does it slightly different. So I kind of just go like this. This is for the low back.
Oh,
Good.
yeah, I got it.
Oh, you got it already?
Yep, you got
Done.
it.
Turn this way. All right, easy.
Oh,
Let's
man.
get this side. Okay.
Oh,
Let's
yes,
go on
sir.
your back.
Woo!
Yes. Oh my God.
Man.
Premiere indeed. This is the premiere right here.
Yes, sir.
All right. There's more in his neck. I just had it.
I know.
Look to the.
Oh,
There it is.
again.
Good.
Wow.
I slide down a little bit. So I don't use the Ystrap. I do it the old-fashioned way with my hands.
Right.
These youngins here, you know, they like the new technology. All right, here we go. This is the old-fashioned Ystrap back in the day. Palmer, D.D. Palmer.
Yes.
All right, here we go.
Oh.
There we go. All right, this is for the rib cage. To open up his lungs so he can breathe for y'all. 1, 2, 3.
Oh, man.
Oh my God, we ain't done yet. Now we gotta get the knee and hip to take the pressure off. 1, 2.
Oh.
It looks like he's getting shot every time.
Oh,
there we go.
man.
There we go. 1.
Oh, yes, sir.
I hope you guys are feeling good. I'm giving him his own medicine here.
Oh, my God.
And we got one more. The finale. You ready for the finale,
I'm
Doc?
ready.
Come on up. We're gonna sit up for this one.
Turn.
Turn this way to the left.
Want me to turn?
Yeah, that's just like that. So you should do this standing up. We're gonna do this seated. Okay? We're gonna put it right here. Right here. 1, 2. Elbows together.
Oh,
Good.
yes, sir.
Hold on. We got one more in there. Let me see.
Oh.
There it is. Okay, good. All right.
Oh, man.
And just because, you know, he really tortures you guys, I'm going to do one different thing. It's a big stretch to open up his rib cage.
Yes, sir.
1, 2, breathe. Breathe out. He's dead. Good.
That was great, man.
Wow, that was a big stretch.
Wow.
You needed that. Every bit of it.
Oh, that
Wow.
felt good.
Huh? Sheesh. Woo. You need to come 2 times a week
Yeah.
for the next 6 weeks.
That was excellent.
Yes.
Oh, man.
And then one of these days put you on the scanner. We could probably put you on the foot leveler scanner today.
Yeah. Oh, yeah.
And you
yeah.
can kind of showcase that, see what your spine looks like.
I can move better.
Yeah. See,
Wow.
you're standing straight now.
Yeah. Like a
Yeah.
boxer better.
Yeah. So basically, what's going on is that his wife told me he hasn't been washing dishes. So we're gonna strap him in and teach him a lesson he won't forget. Alright, so we're gonna hold on to these, the top part. This is basically called flexion distraction, but traction at the same time. And what it is if you have disc injuries, if you have a lot of tightness, stiffness in your back, if you have a situation where you have stenosis, if you're pregnant, this thing goes down. If you have stenosis, this thing goes up. If you just need some traction, if you're sitting a lot, you're tight and stiff in the back. So we start off slow. And we open it up.
Oh, that's amazing.
Yes.
I need one of those.
Yeah, so what's cool about this situation, Doc, is that I can, let's say I want to get L4, L5. I can put my hand right over, like, let's say L4 area and really feel that.
Yeah.
You see that? Okay,
Wow.
you really feel that in the low back only pretty much.
Wow.
And I sometimes even give it a small adjustment with it too. Okay? Like that, so we kind of...
got anything left.
Just when you thought you don't have nothing left, I found one more, huh?
Wow.
And so this is really cool. And then what I like about this, let's say you have left-sided tightness, I can go boom. And I can really focus on this left side here. We can really open it up.
Wow.
Really take the tension off. And
Wow.
really take the pressure off. And we can do that both sides. So depending on your scenario, depending on if the disc is coming out this way, it's coming out this way, it's coming out the middle. So depending on the scenario, we can definitely work with that. And again, as I said, it's great for pregnant women. Or if you have disc injury, we can put you in an extension.
I see.
Exactly, just like that. So that will be even better for you to push that disc back in. Because as people don't know, the disc comes out from this way, so we're trying to push it back in. So
I see.
yeah, exactly. Put them into the extension and kind of stretch out, take the pressure off the disc.
Okay.
And then we just lock it up here. And this thing also has something a little different. Hold it tight. And this one is for basically cervical spine. And it's a retraction, or actually traction for the cervical spine, where sort of looks like the Ystrap from the other side. Since he Ystrapped me. I'm not gonna let him get away that easy. Alright, and so I unlocked this already. I can also unlock it from here and here where I can pull it. We'll have a track. So this is good for people who have disc injury in their neck. So you pull it and then you can pull it down and stretch them out just like this, okay? And let's say the disc is coming out this way. We can close it up on that side, okay, just like that. Or we can do this way. Just depends on the scenario. So we can take the tension off, take the pressure off of the cervical spine, the neck area. So this is good for people that have stenosis again, disc injuries, tightness, stiffness. Good. Come on up, Doc.
I see.
So this is really cool, yeah.
So I mean, what is this, like $20,000?
This is like, yeah, just like a used car or a new Prius.
Wow.
All right, so yeah, this thing is super fancy in that sense, but it does a lot of different stuff. So it's really cool. We can strap people down or not strap them down. It gets really big or really small, and it does couple different things. So we have like 3 of these at the office.
Oh wow, yeah, I gotta get one. Like we're like.
So they're different. I like Hill AFT.
Hill AFT.
Yeah,
okay,
so
yeah.
that's a good company I use. There's I have another company I use as well. But they have, I think, the best as far as quality goes.
Because you can use it just as an adjusting table.
Exactly,
right,
yeah.
right.
I adjust on it, I
Right.
traction on it. Everybody sort of goes on top. I
Right.
kind of traction. Everybody's sitting a lot, so
No,
I kinda,
absolutely.
yeah, I kind of take some pressure off of them.
Okay.
And then you can get it where you do drops here. It gets more fancier than this too.
Right, right.
So
But
you
of
can
course,
get different.
probably
You can
costs
do
way
a
more
drop
too.
here and a drop here. Yeah, exactly.
Yeah.
So
Okay.
you can do cause it this thing, obviously drops on this side too.
Right. I see.
So there, different situations you can add motor to it, do it automatically or not automatically. You can do it with your own hand if you wanted to.
I see.
So it just depends on how you want to use it.
Okay.
And kind of go from there.
Perfect. So I'm just checking just a range of motion. That way I can see what I need to do. As far as the adjustments.
Oh, you
Oh,
feel
and
that?
that reflection is a little tight, right?
The right side, yes, sir.
Yeah. All right. So I'm actually going to do a lift. Okay.
Okay, here we go.
So I'm going to have you at the edge of the table.
Okay.
Is it okay for me to get on?
Yeah, go for it.
That's
Yeah,
cool.
yeah.
All right.
Here we go.
So I
Yes.
want you to just relax. Okay.
Okay. Yeah.
All right. Gonna put you to some side rotation.
All right.
Drop your head in the palm of my hand. Good. Drop it. Relax a little more. Relax.
No, I'm kidding. Got him. That was great. That was amazing.
Not too bad?
Yeah, no, that was awesome. That was on point.
All right. So let's
Yeah.
target the other side.
All right, let's go.
All right. Let's see what we got here. So same scenario. Rotate. Just go ahead and drop your head in the palm of my hand. Relax. Relax a little bit more.
Woo! Jesus, is that you? That was great. Honest to God. Wow.
How's that?
That was amazing.
Not too bad?
I mean, that was on point.
That was on
Hey,
point.
that's it. That's it.
Let's do that rotation from you again, Doc.
Okay.
Okay.
Perfect.
Not bad.
Huh?
That lateral flexion. Okay.
Yeah.
Not bad.
Feels good.
All right.
That
So
was
let's
on
target
point.
this area here.
So
Let's try to target that cervical thoracic junction.
Okay.
I want you to just relax for me. Relax. Okay, let's go to the other side.
I think with that first one, you
The
got
first one,
everything.
yeah,
Oh
we
my
got a
God,
little bit of that
knocked
first
off-
one. Yeah.
that knocked everything for me.
Relax. Good.
Oh,
Yes, sir. Yes, sir.
That's it.
That's it.
I'm
That's
ready.
the one.
I'm ready for bed. I'm ready for bed. It's nap time.
That's the one.
Oh my God.
All right.
All
So let's
Wow.
target the. Actually, I want to do the lower thoracics, mid thoracics, right in here. But let me check your motion first.
Okay, let's do it.
Have you rotate for me a little bit. That's
I
still a
feel
little
that.
tight. Yeah, that's still a little tight. Let's
Yeah.
go to the other side. Yeah, that's still
That
tight.
one's tight too.
All right. So I'm gonna have you
Uh-huh.
sit like this.
Okay.
We'll
Oh,
place it on the
interesting.
table like
Okay.
that. Yep.
So I'm sitting on this side.
Yep, just like that.
All right, let's go.
Perfect.
Okay.
Take your arms.
I'm
There you
writing
go.
notes
Good.
here.
And a lock.
There we go.
I'm gonna bring you back.
Is this the ride? I'm going Kingston Mini,
And then
guys.
Just drop that. Just drop and relax. There you
Okay.
go. Perfect. Take a deep breath for me. Let it out. Let's do that one more time. Deep breath. Out.
Oh,
Yes, sir. Yes,
Oh,
sir.
wow.
There it is.
Wow, dude, this guy's the GOAT. I'm serious.
Yes, sir.
I was on a rod, one of those, you know, and there's like cameras at me, you know. I'm like,
You got everything
I
in
feel
that
good.
one.
Yeah, that was on point. Wow.
Yeah.
I'll be honest with you, I've never seen that one before.
How did that feel?
That was great.
Felt pretty
Yeah,
good?
that was on point. Yeah.
So I want to try and get this portion.
Okay.
I may not.
Is there any
because
more left in there?
that's what I'm trying. I'm trying to get T2, T3, T4.
Okay, let's
we'll
go.
find out. So let me
All
have
right.
you stand up.
Stand up, all right.
Both arms are coming up like that.
You got it.
2 inches apart for me, a little bit more. Just like that. Perfect.
Uh-huh.
I'm gonna reach in.
Uh-huh.
Good. Put both of your hands on top of my hands. Interlock your fingers. Squeeze your elbows. I'm gonna bring you back. Squeeze.
Oh, you got it right on
Yes,
the spot.
sir.
Wow.
Yes, sir.
Respect. That was great.
Yes,
you got it
sir.
right at the T2, T3.
Right at T2,
T4.
T3.
Yeah,
Yep,
that was great.
Yep.
Wow.
Perfect. That.
I mean, that's it. You got more cracks than I got bones. I'm serious. I don't know. There's only 25 bones in here. I have like 60 cracks. That's very good.
That was awesome. All right, so let's take a look at your lumbars.
Okay.
Right. Before you go on your side, let me check the motion. I just want to see what type of motion I'm working with. Let's have you extend for me. Good.
Okay.
All right, rotate the other way. Have you extend for me there. Okay, perfect. All right, on your side, face me.
Okay, there we go. All right.
All right, so position a bit. There you go.
Oh, yeah.
Perfect. Straighten this leg out a bit more. And this time I'm going to focus on the SI joint.
Okay. There we go.
Deep breath for me. Out. One more time. Deep breath. Out. There it
we
is.
go.
Yes, sir.
Yes.
All right.
Oh, man, that got right on that side.
Yep. So now I'm going to focus on the upper lumbars. So the position is going to be a little different.
Okay.
I'm going to reach in this time.
Yeah.
And I'm going to stabilize the thoracic.
Okay. I'll hold on tight.
And this time I'm going to bring the leg up.
Uh-huh.
That way I create a little bit more tension. Take a deep breath. Let it out. There it is.
Wow.
Those were lumbars.
This guy, let me tell you this. You gotta go gambling with this guy because he'll call out the number he's gonna get. I swear. This guy would be like 24, he'll get fucking 24 right there. I didn't go to MGM with this guy. There we go. Wow, that was great. That
How
was
did that
on
feel?
point. That was great.
Not too bad?
No, that's perfect.
All right.
I mean, my full spine is like, I'm
so
good.
So now the last one is the white strap. You never got the white strap.
Oh, that's a. Is there
Right.
gonna be? You gotta add more white shit? I mean, is there anything left in my? I mean, go for it.
We should
I
get
never
it.
want to do it.
Have this right in the middle. Okay. Just like that. Perfect.
There we go.
All right. So let's bring your head up. Drop your head down. Good. All right. Now,
There we go.
here we go.
That's it.
Roller coaster.
I'm ready for my fate.
So I'm gonna do a few pulls, Doc.
I'm glad I went to church this weekend. Just kidding. There we go.
And you let me know if you feel any pain. You should feel the tension of me pulling, but no pain. Okay.
Yeah, I definitely feel. Oh my god.
You feel the tension.
This is gonna pop all the way to my low back.
You already
God,
feel it, right?
it's over.
Take a deep breath for me.
Mom, I love you. I'm just kidding. Alright, take
Deep
a
breath. Let it out. Good. Okay. One more. Was that okay with that pain?
Yeah, that's what
that was fine.
I feel like you're playing with me, Doc. You know this is you know, it's like you're taking me there, but you're not. You know, you're letting go. You gotta. Here we
There
go.
we go. Take one big breath and let it out whenever you're ready. Let's do that again. Big breath. Out.
Oh wow! Are you sure I can move out of this one? Oh my
I
god!
heard everything.
Wow! What did it pop? My low back pop,
Yep,
my
all the way
mid back
down.
pop, my left leg pop, my knee pop, my toes pop. I think somebody outside popped just walking around. JB popping over there, just popping. Oh my god,
Yes,
that's
sir.
it. I mean, I don't know.
That was
I don't know.
it.
This is it? Oh my god.
Come up. Move
Honestly,
around
this is
for
the
me.
best I ever felt. Okay. Jeez.
Shit, yeah.
I'll be honest with you, this was another level.
Yeah.
Yeah, I felt that all the way.
All the way down.
Yeah,
to the
all the
lower.
way. Yeah. That was great.
Nah,
Wow,
yeah,
wow.
that's
Respect.
Yes,
That was
sir.
amazing. Appreciate you, man.
Absolutely.
That was awesome.
absolutely.
Yeah. Okay. So what you're gonna do, you're gonna step on top of that.
Okay.
So one on here, one on here. What this is called is the foot leveler's foot spine scanner, and basically we click on here. Good.
Oh, right here.
Put regular.
Regular.
Okay. And then put birthday.
That's June.
God damn, here's the year. 18. Don't delete that, dog. That's a bad
Oh, five. Well, 5.
You don't have to lie. I heard everybody lies about an inch.
Right, about an inch.
About everything. I think you shoot. It doesn't matter. It doesn't matter. Okay, here we go. Next. Let's get fancy. Okay, now here's the thing. Now this portion is going to take a scan of the feet. So you can take a look at the feet with the camera if you want to get a little closer. But go ahead and press scan and stand still. Don't move. And you're going to see it's going to be a laser scanner right to the feet. Okay. So this portion will kind of tell us how much pressure you're putting on each feet.
Oh.
Okay. Then it's going to photocopy your feet. This is going to tell us what's going on with the foot as far as if you're flat or not. Okay. So now it's done. You're gonna turn to the left. Actually press next. Actually, let me see. It looks good. Okay. Yeah, you did a good job. Press yes. And then now it's processing that information.
I see.
And then you're gonna press. You're gonna turn to the left. It's gonna tell you in a second. But, okay. Now, just like that lady, you're gonna turn to the left to your side. Good. Good. And then you're gonna, as soon as you click on take a picture, you're gonna look straight ahead and wait 3 seconds. So right here, just take a picture and look straight ahead. Okay, done. Okay, the whole thing is done.
It's done.
So now you press next, and then all the information will go into my computer. Press next again. His foot is jacked up. All right, send the doctor. There we go. And press one more time. Send the doctor. It's done. Okay, good.
Okay.
So now you can put on your shoes and socks. The whole thing is done. And then,
Okay.
I can pull my computer.
Okay.
I'll bring it over here. All right. So basically we pulled up his scan, and here's what it looks like. Your feet should look like this. It should be red, green, and red. There's actually 3 arches in your foot, and it looks like all 3 have collapsed nicely. So you have a little bit more arch here than on the right side here, but so basically 0 to 34 is normal foot stability. Hers is 138. So severe, that means severe flat. 125 is severe, his 138. Okay, no big deal. And actually a very big deal.
Yeah.
All right, so now there's a 7.42 millimeter difference between the 2 feet. What that means is that imagine if you have a house and one pillar is here, one pillar is here. And so that's what it looks like. On this side, right ankle, right knee, right hip, you put in more pressure on the right. This is after the adjustments too. And to compensate the right side left shoulder dropping, so that's usually causes the left leg to be shorter than right by a little bit. And that causes into the neck, tension to the neck and back. And so what happens with this case is that we can fix this all day, but if we don't actually fix the inequalities in his feet, it will keep coming back.
Right,
exactly.
Right.
Yeah, because that's a foundation. It's like there's a crack on your wall, but your floor is crooked.
Gotcha.
Okay?
Gotcha.
So you can fix the wall all you want. So here's what it looks like on his neck. So what we need to do, this is the middle of his ear. He has a little bit, not bad though, but about 1 inch forward head posture. You can see this roundedness here, and you can see your camera person here. But she looks like she needs it after this. But every inch your head is forward. That's what it looks like inside for him. But not as severe, but sort of like this. But every inch your head is forward, it adds 15 pounds of load into your spine. So what we have to do is kind of correct that. So then we come in over here. It does recommend the orthotics. According to them, I think it's vital for him. So life or death. But that's sort of what it looks like. But his difference between as far as balance goes is not too bad. So we do want it to be less than 1%. It's about 3%. I usually see once it hits 55, most people have some sort of back pain or neck pain.
Gotcha.
That's severe, like a lot more pressure. That's how people end up with one hip replaced, not the other. You might have ever heard of that. Why is it one hip, not the other? It's because you put more pressure on one side over time.
Right.
Exactly. So that gives out. That's the whole thing about it. Cool.
Okay.
All right.
So then once you get the scan, how does that work? You contact
so basically what at this point the doctor goes over, so I usually go over this and we'll do a treatment right afterwards based on what we found on a scan, okay? And based on the history and the examination. And then at the end of, so let's say they need, I don't know, 10 visits, 12 visits, whatever, at the end of the 12 visits we'll put them back on a scanner, we'll compare them to the first day.
I see.
So we do a little before and after, so not only they'll see that improve, they'll feel it, they'll hear it, and then they'll see it on the computer, what the computer says, and we showcase that to them to show that. But they definitely need orthotics. So at this point, if it's severe, we recommend that. We have many different types, but you can go to the full catalog, and we usually pick the ones for it. So based on if they're wearing dress shoes, if they're wearing heels, flat shoes, running shoes, depending on dress shoes for men, for women, exercise, if they're a construction person, and then if they're kids, if they're, their specialty, if they're like runners or golfers, and there's so many different kinds. And then they also have different stuff for kids and the whole shoe with the orthotics in it, slippers, all sorts of stuff.
So based on the scan, one will be more than the other, like higher than the other, so it can correct that balance?
Exactly. So we correct that balance, and based on it, they'll custom make it per foot. So this is not made, so it's not like a CVS thing where they just give you the same thing, they hand it to you. These are made differently because your feet are different for your case. 7.43 millimeters difference. So they have to be differently so we can correct that situation going up. Exactly.
Wow, I need to be adjusted more.
2 times a week, 6 weeks, that's it. Here, Dr. Phil Morgan here. He just let you go and tell a little bit about yourself.
What's going on, Phil?
So my name is Dr. Morgan. I come out of Baltimore 3 times a week. I'm a personal trainer up there. Undergrad in sport medicine, master of sports rehab, doctor of sport and performance psychology. And what I do is like a full body stretch, and I titled it clinical movement enhancement. Kind of movements that a chiropractor does, kind of movements that a massage therapist does, but kind of differently in my own lane. So Dr. Reza has been my mentor for almost 2 years, and I just take what he gave me for the foot levelers as an assessment tool, and I just use that to work on the musculoskeletal system. So he works with the spine and the bones, I work with the muscles. So my job is to set you up for your visit. So when you leave my table, you're more loose, you're more limber, so it's so much easier for my chiropractor to adjust you. So that's what we do. We do an assessment. We do a couple assessments, and we see what your range of motion is prior to you getting on the table. We reevaluate you, then we change your life for the next couple of weeks, and then you're with us.
So we kind of work hand in hand here, because what we try to do is make sure that when the patient sees me, they're not like stiff and tight. Some people are just like really tight, right? And have a lot of pressure on that, and we try to work through that. They're gonna even injure themselves, or like they get hurt or get really sore, different pains. So he really helps out as far as loosening them up, make sure the muscles are less tense, make sure they're happy, they're nice and relaxed. When they come in, they already had a good experience. They're just flowing through me, and then I can just kind of do my thing with no problems. So we sort of work hand in hand that way. But he has this room, he has the other room, so we kind of have a big area here. We have 9 treatment rooms all together, and we kind of work hand in hand to make sure we give everybody a good experience with the ergonomic people. So we have the ergonomic, we have the clinical movement enhancement, we have the chiropractic, we do physical therapy, rehab,
so
all
they get
that
the
stuff.
full treatment.
Exactly.
That
So
makes sense. That makes a lot of sense.
we got the full 9 yards here.
Okay.
All right, cool. I just want to kind of give you a demo there.
All right. Okay.
That was awesome.
Thank you. Appreciate
I
it.
appreciate you.
My man.
All right.
You got it.
Yeah, so EM sculpting is something cool. The machine is not on yet, but it turns on, and what it does, it actually strengthens muscle. So if you want to You want a new booty? You want a six-pack ab? You know, we all could use a little bit. But basically, according to the research, 60% average muscle gain, 90% average fat loss. So we put that in. You need about 4 sessions of it, 30 minutes a session.
Okay.
Okay. So
and the results are apparent.
So
like, you know,
yeah, absolutely. You can see. Yeah, exactly. So
Yeah.
we do a measurement.
Okay.
We do a full scale and everything like that. We have we actually do a tape measurement, old fashioned.
Okay.
We'll hold on, look at their fat, content and all that, water
Gotcha.
content and stuff like that. And then after the 4 visits, we do twice a week for 2 weeks.
Okay.
We'll do a full measurement again, and they'll see a significant. Like it's obvious.
It's obvious.
Oh, yeah,
right.
it's obvious. Yeah,
Wow.
exactly.
Okay.
So this thing was really good. So you just come here like a spa. You lay there. We work on the area you want. We can either do abs, glutes, hamstrings, and quads. Okay. So those are the 4 areas we work on.
Okay.
And then, and also calves, but it depends on if you want your calf. But most people just stick to these 2 areas.
Glutes, yeah.
That's the main course.
Right.
Yeah, it's the main course.
Virginia.
Yes, DC, Alexandria.
Alexandria.
Absolutely. So if he's too booked, come see me.
Absolutely, absolutely. If you guys in the VA area, definitely check out Dr. Rizzo. Because you know, some of my patients sometimes we're booked for like 3 weeks, 4 weeks,
Right,
you know,
exactly.
and they complain that they can't get in on time. So if you guys can't get in, come see this man. He'll take.
Absolutely.
Obviously, he adjusted me. It went well. Everything went well. So
Appreciate
come check him
you.
out.
Absolutely.
One more time. What
Yeah.
is the Instagram?
My favorite doctor. So
Okay.
MySpace favorite or _favorite _ doctor.
Okay.
And then come check us out. That'd be really good. And then for my people as well, Pain Rehab DC is his Instagram, and as well as YouTube is a Pain Rehab.
It's Dr. Nessie Clergy.
Oh, okay.
Just type in Dr. Nessie
Clergy Chiropractic. I know that.
Just type in Dr. Nessie Clergy, it'll pop up.
That's perfect.
Right,
Appreciate
yeah.
you, Doc.
Okay.
That was amazing.
My man.
Thanks so much.
Got it.